Hi everyone, my name is Armida. I'm a first year pharmacy student in Canada, and today I wanted to make a video about why I chose pharmacy over medicine. So this is a kind of video that I used to watch a lot while I was an undergrad and I was trying to decide what career I wanted to go into. I had an idea, like a typical science student. It was either between medicine, dentistry, or pharmacy. So I'm gonna tell you a bit about my story and give you some tips if you're in the same position that I was in, and hopefully it can help you whether you're still in high school, you're just not sure which career path you want to go into in the field of science and healthcare. Hopefully I can kind of help you out there. I also just want to say before I start that I'm not trying to discourage anyone who's interested in medicine. This is just my personal story, and I know that a lot of people might be in the position that I was in, kind of thinking that medicine is the path that we want to go into, not realizing that there are other career options in healthcare out there that might actually be more suited to what we have in mind and our interests. And so that's kind of what happened with me. So if you're interested in medicine, please, this video is not meant to discourage you. Medicine is awesome. My dad's a doctor. This is just my story. Now, let me start by giving you a little bit of a backstory into me. So when I was in high school, I was super interested in biology. That was my favorite subject. I was also really good at English. I always did really well in English, but it just wasn't something that I saw myself pursuing as a career in the future. I knew that I wanted to work in healthcare. And so in university, I got a Bachelor of Science in Biomedical Physiology, and I was in that program for 5 years. And so in that program, we did a lot of human physiology courses, biochemistry. The program was really rigorous, and so our upper division courses, we had a lot of more specialized courses. For example, a course I took in my last year was a cellular molecular cardiac physiology course. I know it sounds intense, and it definitely was intense, but it was really, really interesting. And in a lot of these courses, we learned about drugs that were used for different disorders that we talked about, and I was always super interested in those. Now, going back to my very first year of university. So I went into university thinking that I wanted to go to medical school, and I was dead set on medicine. I even knew that I was interested in going into dermatology. And so my program and the courses that I would take in my program kind of served as they would fulfill the requirements, basically the prerequisites for medicine. And so I went in, I was ready, I knew that I wanted to go to medical school, but things changed a little bit, as they do for a lot of people. A lot of my other classmates as well, it's just the case with a lot of people who are interested in working in healthcare. When they first go into university and they're doing a science degree, a lot of them want to go to medical school. But the reality is, as you take different courses, talk to a lot of different people, through your volunteer or work experience, your opinion changes because you learn a lot more about what's out there other than just medicine or dentistry. I feel like these two are the top two careers of people who are interested in healthcare, and that was definitely me as well. By the way, if I'm looking down, I have my iPad here with a list of points that I want to talk about, because if I don't have this, I'm just going to ramble on and on incoherently. So please don't mind that. Now, like I said, I took a lot of courses for my program that were really specialized. And even in my core human physiology courses, we learned a lot about different drugs and different disorders. I really enjoyed how specific each of those was. And so right off the bat, something I knew was that even if I were to go to medical school, I would never be interested in becoming a family physician or a general doctor. I saw my family physician. I thought the job was honestly a little bit boring. Sitting in your office all day, only spending like 2 minutes with a patient, I thought that was kind of boring, especially for the amount of time you have to put in, because you need 4 years of medical school and then you need at least 2 years of residency to be able to even use your MD. So 2 years of residency would give you a license to work as a family physician. So I knew that I wanted to specialize. And at that point, I thought that maybe a better career option would be to go into dentistry, because instead of 6 years, that would take me 4 years after undergrad, because to be a dentist, you only need 4 years of dental school and you don't have to do a residency to work as a general dentist. About 2 years, like halfway into my undergrad degree, I had switched from wanting to do medicine to dentistry because A, I knew that I wanted to learn about something more specialized right off the bat, and B, it was going to take me less time to finish. However, I ended up not going into dentistry. And at this point, I want to be completely raw and honest with you guys. I felt like I didn't have the grades for dentistry. And especially in Canada, if you're a Canadian student watching this, I'm pretty sure you can relate to what I'm saying here. In Canada, there's, if I'm not mistaken, there's 6 dental schools, whereas in the US, there's 66. So that's 11 times more. And I know the population is obviously greater in the US, but think about it. You have so many more options there. And so that in and of itself makes it a lot more competitive in Canada. And on top of that, in my province, there's only 1 dental school. And if you want to apply to dental school in a different province, you're considered out of province, and they only have a specific percentage of seats reserved for out of province students. I think it's something like 5%. And as you can imagine, that 5%, people from all over Canada outside of that province are going to be applying, and so that's why it's super competitive. The class size is small, that's another reason why. And I honestly felt like my GPA was just not good enough, and so I didn't want to waste an extra year studying for the DAT to take it only to fail, was basically what I was thinking, only to get rejected. And so I kind of put dentistry on the back burner, and at that point, that was when I was taking these really interesting upper division courses where we learned about specific disorders and diseases and drugs relating to those, and I became really interested in pharmacy. And I thought, I've never considered pharmacy, so maybe I should look into it. And I started watching a lot of YouTube videos, day in the life of a pharmacist, day in the life of a pharmacy student, why I chose pharmacy over whatever other career path. And I started realizing, a lot of the things that I'm seeing and hearing are very interesting. I could be interested in pharmacy. At that point, I decided that maybe I should volunteer to pharmacy and really see firsthand what it's all about, because pharmacy is one of those careers I feel like it's not as well known as medicine and dentistry, so a lot of people really don't know what pharmacists do. It's kind of sad, but it's true. And so we had family friends who were pharmacists. They had their own pharmacy. They were a couple. They still exist. They're still our friends. And I volunteered with them for a couple of months. And I realized that, I can see myself here working as a pharmacist. I loved that the job was really fast-paced. I felt like that made the day go by really fast, and that was something that I always loved. I really also like the fact that pharmacists could spend a lot more time with their patients. Physicians, I feel like they don't have a lot of time to spend with patients. They have so many patients, and they're not as accessible because you have to make an appointment, whereas you can just walk into a pharmacy at any time and ask the pharmacist any question, really, and they're so knowledgeable. The pharmacists that I was volunteering for were so knowledgeable, and their patients really trusted them, and I really got to see that, and I saw what a difference they could make in, you know, not just the health of their patients, but their mental well-being. Because sometimes they would come in, especially the older patients, and they would just, you know, say, oh, I was passing by, I wanted to come say hi, or, you know, they got back from vacation and they just wanted to chat. And I really love that aspect. You know, that's something you can't do with your physician, because, you know, you need to make an appointment, you need to have a medical reason why you're going to see them, whereas with a pharmacist you really have kind of a special relationship. Another thing that made me lean more towards pharmacy than medicine is the flexible hours as a pharmacist, and even as a pharmacy student or resident. So you would not have to do overnight shifts, you don't have to do crazy hours. It's really flexible. It's more of the, you know, 9 to 5 job, and that's something that was always really important to me. So this is a good thing to keep in mind. Do you not mind not having, you know, a set 9 to 5 kind of schedule, or does that bother you? Because for me personally, I always knew that I wanted to have a schedule that was predetermined, I guess, and flexible. So I wanted to know that I'm working from this time to this time, and then afterwards I can go home, I can, you know, relax a little bit, I can unwind. Sleep is very important to me. I'm one of those people who gets physically ill if I don't sleep a lot, or if I don't sleep enough, I should say. And so that was also really important to me. So there's a lot of little things like this that you have to keep in mind, and they can ultimately help you choose which career path is more suited to your lifestyle. And another point I want to mention is that I am a pretty squeamish person. I hate the sight of blood and needles, and, you know, imagining myself cutting into people is just something that I cannot do personally. And so in medicine, you know, you have to learn your suturing and all that kind of stuff, and especially in dentistry, you do a lot of procedures that are invasive, and you're gonna have to be cutting into people, and you're gonna be seeing a lot of blood. And, you know, that's totally something you get used to, don't take me wrong. If you're squeamish like me, if you don't like seeing blood, that doesn't mean you can't go into medicine or dentistry. That was just something else that kind of helped me lean more towards pharmacy. And so in summary here, I kind of want to summarize all the points that I mentioned. I feel like this video is going to be kind of disorganized. I'm sorry. I hope it doesn't bother you too much though. Okay, so point 1, pharmacy is not as long as medicine would be. It's 4 years versus 6 years minimum to be able to work. Number 2, pharmacy is a lot more specific from the beginning. I kind of, to me, felt like I was entering into a specialty in healthcare versus having to finish medical school and then specialize. Number 3, you have a lot more work-life balance. It's a lot better, flexible hours, 9 to 5 kind of job, depending on where you work. If you work in a hospital, it might be different, but, you know, still overall, just a lot better hours. And then lastly, I'm not sure if I mentioned this previously, but I really like that there's a balance between the amount of independent work you do, the amount of teamwork you do, and the amount of time you spend physically with patients. So, you know, you don't necessarily have to even touch patients, you don't have to do physical exams really. Also, I'm squeamish, and I like that I don't have to do any procedures apart from just immunizations, injections. And so I have 2 tips for you if you're trying to decide which career path you want to go into, if you have a couple in mind and you're not sure which one you're more interested in. Number 1 is to do your research and eliminate your options. So if you know what you don't want to do, it's a lot easier to narrow things down and kind of decide what you do want to do. For example, not wanting to have overnight shifts, not wanting to put in 12 years of schooling, these could be examples, and you can really eliminate your options, and that's kind of what I did as well. And do your research, so watch a lot of YouTube videos, day in the life videos. You know, these can really help because you can really see what the daily life of someone in that field looks like. Number 2 would be to definitely shadow or volunteer someone who's already in that field. I can't stress enough how big of a difference this makes, because you might know on paper exactly what a career path entails, but you really won't have a good idea until you actually see it in person. And so for me, volunteering at the pharmacy definitely helped me decide whether I see myself there or not. You really get a feel for the work environment. You see a lot of things that you wouldn't otherwise see. This is the career that you're gonna have, the profession you're gonna have for the rest of your life. You're putting in a lot of time, a lot of money, a lot of effort to get there. So you wanna make sure that this is exactly where you wanna be. And volunteering or shadowing definitely helps you realize that. It definitely does. Now, lastly, something I want to say is that people will tell you a lot of different things. So if you're doing your research and you're talking to people in these different fields, you're really unlikely to find somebody in a career path who has absolutely no negatives to say about it. So really, people speak from their own perspectives, and it's up to you to take what they say objectively. You know, doctors might discourage you and say that it's too long, it's too hard. Pharmacists might tell you that they wish they did something else instead. But you know, the truth is that you'll rarely find someone who doesn't have anything to complain about. So don't let that discourage you. Take what they say objectively, and shadow and volunteer, watch more day in the life videos, and you know, I hope that ultimately helps you decide the path that you want to pursue and that you're happy with your decision. So that brings us to the end of this super disorganized and rambly video. I hope it helps you out in some way. I hope that hearing my story and kind of the things that I kept in mind when I was deciding what career path I was interested in kind of resonates with you. You realized maybe a couple of things you want to keep in mind. And if you're already a student like me, leave a comment down below, let me know what program you're in, or if you're still in high school or undergrad, let me know what you're interested in. And have a wonderful day, and I'll talk to you guys soon. Bye.